Essentially, with the product, there are three modules, two that will be vertical and one that will be horizontal. Clip them into the clips on the strap, and we'd like to position the horizontal module at the back of the knee. What we're essentially trying to do here is have the knee at 90-degree angle, and we're trying to put as much of this laser light on the synovial fluid. The synovial fluid is kind of like the oil or the WD-40 for your knee. It surrounds your knee joints from a cartilage standpoint, and one of the things that you see with osteoarthritis is that that synovial fluid has higher levels of inflammatory markers, and it's one of the key ways for us to be able to reduce the inflammation and help provide a path forward for being able to regenerate that cartilage in a more meaningful way. So where you have kind of a 90-degree angle, there's a line on your knee, and you'd like these to be pointing directly into this. If you position this correctly over the synovial fluid, we're going to see a reduction, and not a small reduction, a really substantial 60 to 80% reduction, depending on which study we're going to reference for it, in those inflammatory cytokines, inflammatory markers in the synovial fluid. If that inflammation is the cause of your pain, that's going to have an immediate impact on your pain. If that inflammation is not a cause of your pain, what you're going to see is over time, the degradation will slow and the regrowth will boost, and you'll see your knees just feel easier. And so this is why we see some people saying like, hey, immediately my pain is down. That's probably because in a lot of cases, your pain is caused by this inflammation, and the inflammation is impacted very quickly. The automatic cycle that is on the device is 5 minutes. And the reason that it's 5 minutes is that it's much better for you to do daily for 5 minutes than it is for once a week or maybe twice a week for 15 minutes. One of the other things that we'd suggest if you have chronic or very high levels of acute pain in your knee is after treating this area for 10 to 15 minutes, which is 3 cycles. We have 5-minute cycles on the devices now. We'd like to advise that essentially with most chronic pain in joints like the knee, especially with traumatic tissue damage you see with things like meniscus tear, ACL, MCL tears, things like this, you're not just going to see a reduction in effectiveness of blood flow in the traumatically damaged tissue. You're also going to see that in regional tissue. And so one of the things we found very effective for this is being able to treat upstream where your quad and your hamstring tissue is actually being impacted negatively from a microvasculature standpoint. How much blood is being delivered into your quads and into your hamstrings is reduced because of the tissue damage in the knees. So we would advise to slide that up also after your 10 to 15 minutes of treatment on the knee, and then treat for another 10 to 15 minutes in the broader tissue of your quads and your hamstrings. You should be able to slide that up with some adjustments and then seat it on the lower part of your quad and then the upper part of your quad. And so we'd say in maximum 3 treatments on the quad after 2 to 3 treatments on the knee is a good addition to a protocol if you have knee pain or osteoarthritis in the knee.